this is my video response to the needs and challenges for disaster for my crisis response and trauma care class. So to begin, natural disasters and incidences often occur unexpectedly without prior warning. Each person is likely to encounter some form of disaster at some point in their life, whether it affects a loved one or them personally. Such events do not follow a particular timeline. Rather, they're just unexpected. During such events, the disparity between needs and available resources can result in damages that surpass the community's capability to respond. So with that, disaster risk management within the health system is an ongoing process that prepares health service institutions to respond effectively to emergencies. This entails strengthening organizational structures, operational procedures, and health workers' competencies through training, risk assessments, and the acquisition of emergency equipment. It is crucial to recognize the individuals who experience traumatic events, such as the natural disasters, undergo 4 distinct phases in their journey towards recovery. The first stage is the heroic stage. The second is the honeymoon phase. The third is the disillusionment phase, and the fourth is the reconstructional phase. During the heroic phase, disaster survivors may deny the full impact of the event on their homes and their families. They may resort to extreme measures to protect their loved ones and may even hoard community resources. Survivors often encounter denial and tend to overlook long-term consequences. And so in the honeymoon phase, the second phase is considered to be the peak of the initial emotional response. Survivors experience unrealistic positive feelings, profound gratitude, and a belief that everything will stabilize, focusing on a hopeful narrative. It is important to note that during natural disasters, vulnerable populations such as elders and younger children are at a heightened risk. Subsequently, the disillusionment phase occurs when survivors realize that recovery will take considerably longer than initially anticipated. This realization can lead to feelings of hopelessness, abandonment as internal assistance diminishes. Fears to financial stability start to come about, leading to helplessness, anger, and all of these emotions can contribute to PTSD, anxiety, and depression. So with that, just to highlight, post-traumatic stress remains one of the most rapidly increasing mental health crises known to date, and it takes years to overcome. Mental health disorders frequently originate from unmanaged stress and trauma in an individual's life. So next, here are several methods for implementing interventions prior to a disaster. These may include providing training, assisting individuals in developing disaster response plans, centering Bible studies around spiritual disaster preparedness, establishing multiple technology communication channels, collaborating with other churches to offer locations for evacuation or work, and cultivating relationships with local resources. It is also essential to monitor the safety of different individuals using predetermined plans like gathering necessary materials, prepare for response efforts, and ultimately normalizing the concept of disaster within the community. So next, for intervention strategies for each phase of disaster. One, during the heroic phase, responses should focus on addressing safety concerns and meeting basic needs within the impacted community. Pray for and with the survivors. Next, the honeymoon phase interventions may include fundraising, conducting surveys and assessments for PTSD, administering psychological first aid, which is defined as an evidence-informed approach aimed at elevating initial distress and promoting both immediate and long-term coping strategies among staff following exposure. Also making referrals to mental health professionals, making a long-term recovery plans, and providing Bible studies aimed at healing. In the third stage, disillusionment intervention should focus on providing support and services as other nonprofit organizations begin to withdraw. Something else to emphasize is the burnout phase for personnel engaged in the ongoing community service provision. Deliberately specialized community mental health training is important and encouraged for individuals, and organize recreational activities and events to reduce stress. Furthermore, foster hope and healing through Christ and promote community cohesion to combat isolation. Lastly, during the reconstruction stage, the interventions can include celebrating the growth resulting from positive change and utilizing acquired knowledge to assist other communities and churches in disaster efforts. And lastly, to conclude everything, something that I think is really important, especially for the disaster teams, is to lead with empathy. Empathy means putting yourself in the other's lives temporarily and seeing it from their perception and going through it with them, to build on to that sensitivity that sometimes we can lack when we combine what we're going through on a day-to-day with someone else's trauma event. So I just think that's something to keep in mind, especially as working as a part of the response team. So I have included the following resources in my response, which is the needs and challenges of disaster that was provided to me via YouTube. Next would be the article Challenges and Needs in Disaster Preparedness, which was conducted in 2005. Next would be the adherence of the psychological first aid after exposure to a traumatic event at work among EMS workers, that was conducted in 2021. And the challenge of being in therapy and counseling, which was conducted in 2022. So yeah, this was my take on the video response.